The Department of Paediatric Cardiology at the University of the Free State was established in the 1980s and serves as the central referral center for all children born with congenital heart diseases in central South Africa. This includes the Free State, Northern Cape, adjacent provinces, as well as Lesotho. The department delivers a comprehensive pediatric cardiology package, including diagnostic, interventional, preventative and outreach services. Diagnostic equipment, including ECGs and echocardiography, play a central role in delivering these services. Echocardiography or heart sonars are used to confirm a definite cardiac diagnosis, monitor disease progression, and allow regular follow-up. With advanced echocardiography, complex lesions are diagnosed early and optimal treatment programs are planned accordingly. Cardiac arrhythmias and post-surgical ECG monitoring are essential for our children to survive. The department's focus is to deliver a comprehensive pediatric cardiac service to all the children in Central South Africa. These include early diagnosis and treatment programs, teaching and training opportunities for clinicians, pre- and postgraduate medical students, clinical technologists, and nursing staff. The Department of Paediatric Cardiology at Universitas Academic Hospital is the only dedicated referral unit for all children with congenital and acquired cardiac disease in Central South Africa. We deal with an estimated population of 7 million people, and many children are misdiagnosed or only referred at an advanced stage. Factors contributing to this problem include poor referral and primary healthcare systems. Peripheral hospitals and clinics are understaffed and serviced by junior doctors. Newborns are often incorrectly diagnosed with a so-called respiratory problem and never reach our clinics. According to our statistics and population-based numbers, many patients get lost due to misdiagnosis and inadequate follow-up. We are proud to be the only academic unit in Central South Africa involved with the percutaneous valve programs. This was established in 2012 for both pulmonary and aortic valves in the elderly. Since then, we are the only accredited implant center for percutaneous pulmonary valves in South Africa, and I am traveling to several centers across the country to assist the other academic units. Our comprehensive services consist of the following: tertiary hospital services. These include diagnostic, complex cardiac catheterizations, as well as teaching and training. Also, primary care at peripheral hospital level. These consist of outreach clinics, teaching and training, service delivery, and local patient follow-up.
The aim of our Pediatric Cardiology Rural Outreach Program is to offer different needed services, including early diagnosis and treatment programs, teaching and training opportunities for junior doctors, pre- and postgraduate medical students, clinical technologists, and nursing staff at the rural hospitals. Our focus is to identify these cardiac abnormalities early, especially in the rural areas where limited specialty services are available. These outreach initiatives are done by 3 dedicated pediatric cardiologists, Prof. Stephen Brown, Dr. Dani Buys, and Dr. Alicia Ferris, and hopefully will address unnecessary premature deaths of children in our region. The unit was fortunate to acquire a portable diagnostic sonar machine through the MACA Foundation from the Discovery Fund with 750,000 Rand. Our rural outreach program with a dedicated portable ultrasound system increased diagnosis rates amongst pediatric patients. Since the machine became available, we expanded our scope and reached of covering 537 patients, of which many either had an interventional catheterization or corrective cardiac surgery. We do outreach to Bongani, Manapu, Ditlabeng and Pelanome hospitals, we are covering our logistical costs, travel, meals and accommodation from personal funds. However, to sustain and expand the project is an expensive exercise and requires continuous funding and more equipment. We are excited to establish a new outreach service to the Kimberley Paediatric Department for the Northern Cape patients. These outreach clinics link to patient education, on-site training of nursing staff and doctors. The clinics are more accessible to patients and reduce the parents' financial burden. Due to the pressure on the referral system and the difficulty of patients to travel to Universitas Hospital, patient clinic attendance and follow-up sessions improved. The department is involved in training at all levels, and training of staff is essential for recruitment and sustainability of staff numbers and delivery of quality services. The department is involved in various research programs and has a history of regular publications in accredited journals. Research includes regular publications, PhD and master students, contract research, etc.
The Department of Paediatric Cardiology has a dedicated team to deliver special services to the most vulnerable patients in our community. We want to thank all our alumni, sponsors, donors, and friends for your continuous support.